The Sisonke Vaccine Trial is set to resume today, and at least 1 million healthcare workers are expected to receive the Johnson & Johnson vaccine in the coming weeks. From May, South Africa will begin phase 2 of the vaccine rollout, targeting people aged 60 and older, high-risk groups, as well as those with comorbidities. Let's get you analysis of what to make of this moment. Bring in our guest, Dr. Aslam Dasoo, convener of the Progressive Health Forum, joins us now via our video link. Thanks very much for making time. Thanks, too, for your patience. So, today's resumption here in South Africa is coinciding with an announcement by U.S. President Joe Biden that adults who've been fully vaccinated can now be in public without having to wear a mask, at least if they're not in crowds. Yet another sign of just how far we still need to go to reach some kind of herd immunity in this country.
Good morning. Good to be with you. Yes, I think that's a very good juxtaposition of stories because it underlines the importance and beneficial effect of vaccination. Of course, we're very different from the United States, which could have the luxury of pausing its J&J vaccine rollout when it first discovered these clotting disorders in a few vaccinees. We paused as well on that news, but the question must be, asked about why the pause was necessary when that's just a vanishingly small number of adverse events, and the fact that we don't have additional vaccine, which the United States is richly endowed with. So I think that a decision was made, and it is what it is, and we've lost 2 weeks of the Sisonke trial, but I'm very pleased it's resuming today for the remaining 200,000 healthcare workers who are to be vaccinated in terms of the trial, and that trial can be considered as part of phase 1A before we move to phase 1B, which is the rest of the health worker cohort, as you mentioned, up to 1 million of them being vaccinated as soon as the J&J vaccine, we are told, is received from Aspen Pharmacare.
Yeah, I always find it so ironic. I mean, part of the motive for suspending the Sisonke trial was to try and boost confidence in vaccinations in general. The logic was we're suspending it despite statistically how low the probability of blood clotting is, because we want to show that we are being extra cautious in giving out these jabs. The sense I'm getting from you is that there's also unintended consequences from this, including a delayed vaccination rollout, but also possibly more vaccine hesitancy.
Certainly, and I think you're beginning to see that already. There's a recent survey done by one of the universities that's indicating an increasing level of vaccine hesitancy among ordinary people. You see, I think when you stop the trial, as much as you try and explain it, people have a level of anxiety about that. And of course, it doesn't help that the issue was aired so widely in the media. And of course, these are serious adverse events, certainly for the people involved. But when you have 6 out of 7 million in the United States, 6 cases, then you're not dealing really with a major impediment to the vaccination. Because if you consider the alternative, the risk of getting COVID-19 and the risk of serious illness arising from it is far higher than any risk of adverse events among the vaccines. To be sure, all these vaccines are behaving exactly as one would expect. All of them work to prevent serious illness, hospitalization, and death. Now, you have to make a call here. Would you rather take the vaccine and at worst get the sniffles, or not take the vaccine and get COVID-19? And so, I think if this is explained properly to people, they would understand. And it doesn't help to take a knee-jerk response to halting the trial or the rollout, without taking that into account and without having alternatives in place.
What doesn't help is that South Africa also only had just one vaccine that we're rolling out at the time at which Johnson & Johnson was suspended. Speak to me about the efforts that should be put in now to try to diversify the candidates of vaccines at our disposal, especially considering in the backdrop we have public figures like Julius Malema essentially saying that people need to be allowed to have or receive the vaccine of their choice, depending on all kinds of reasons.
Okay, so we must keep some perspective here. If we are going on this mass vaccination drive, there are two important factors. One is security of vaccine supply. You don't want to start a major program and then run out of vaccine, halt the program, which is a huge logistical issue. And the second issue actually relates to the logistics. We're going to have to vaccinate of the order of 250,000 and above people a day. This is an enormous undertaking. One hopes that the arrangements are in place to do that. I know there's good public sector, private sector collaboration on that score. But as to the choice of vaccines, that is determined by what is available. Now, from the government, we hear that they have secured a significant amount of doses, I believe of the order of 30 million from J&J and another 30 million from Pfizer. If these contracts materialize, then that should give us coverage for about 40 million people. And of course, that was the target for herd immunity. But you have to also understand that this is a hugely uncertain period. The world's biggest vaccine supplier, India, is curbing its exports because of the incredible tragedy that's unfolding there now, and they need all of their vaccine. And so these events are going to pop up that may impact on supply. So bearing that in mind, I think we should be grateful for when we get whatever vaccine, effective vaccine, that we can get our hands on and roll that out as quickly as possible without making too many policy, political, or other infrastructural impediments to this. We are now in the emergency phase. We must act as though we are in an emergency.
Strong words as we mark what I think is yet another milestone in our vaccination drive. Hopefully not too many hurdles ahead. Thanks very much indeed for your insights. Really appreciate it. Dr. Aslam Dasoo is a convener with the Progressive Health Forum. Appreciate your time indeed.